Hey there, Dr. Alan Christensen back with you. Welcome to Reset Me with Dr. C. This is going to be one of my favorites. Dr. Anna Cabeca is a dear friend, one of just the coolest people, and one of the leading educators of physicians in the whole world of OB/GYN. Real pioneer in the world of natural hormones and doing it safely, effectively, making sense out of menopause, having her own health be so vibrant and so thriving. And I just wanted to talk about menopause. There's more data about the science of treating it and the relevance of its health impacts. And Dr. Cabeca is like my favorite expert here on this topic. So let's go deep into menopause. And she's had her story that she can share with us a bit too. So welcome, Anna.
Oh, always so great. Thank you for that generous introduction. It's great to be here with you, Alan. I feel the same about you.
Well, so good to have you. And, I think about, everyone knows that hormones are like make or break our health. And they can be off because we've got a disease like Hashimoto's or because we've got dysfunction like adrenals. But a big category is, our genes at some point might be out to kill us, that they intentionally drop off and change our hormones. You want to talk about just like how menopause plays into the arc of our health and our life?
Oh, absolutely. Because it's been such a journey for me. I'm an Emory trained OB/GYN, so I study deep into reproductive endocrinology, into hormonal health. And, what I've learned on the outside and through my personal and professional experience has really been, mind blowing because, some of the things that we're just not taught the concepts of, really the clinical side of in our trainings. And so many women are suffering during transition phases in their life because of this lack of real appreciation. The idea is what happens in medicine. Women will come into the office and we're like, okay, well, let me, as a doctor, I want to help you suppress that symptom that's making you uncomfortable right away, because we don't want our patients to be suffering, right? But that addresses the symptom, not the underlying cause. And lo and behold, if you do one Band-Aid, you've got to do another Band-Aid and another Band-Aid, which turns into multiple medications, sometimes surgeries and diseases down the line that later, after you've taken out your uterus and your ovaries, you're down the road to the psychiatrist because, what else is going to help you? And versus we're getting to the underlying root cause issue. What's causing the imbalance in hormones? Sure, there's that genetic component, just the aging, the natural aging. But there's more than that. There are many disruptors in our life and our modern day existence that create hellish hormonal experience, to be honest.
So why is it that you see that for some women, like, menopause, what's that? No big deal. And others, you're right, it's like a total upheaval. So what are some of the big variables that cause it to go one way or another?
One of the biggest variables, honestly, especially in menopause, is the association between early trauma, PTSD, traumatic childhood, whether it was abuse, an accident, fire, any trauma that could have caused PTSD or any abuse in childhood or as a young adult, etc. We tend to experience menopause with more fluctuations, more troublesome. And a reason, and it also may also be related to traumatic brain injury, right? From a car accident, a fall off a horse or a bicycle, playing soccer, right? So what we're seeing in those, veterans that come back from war, but in general, in people with PTSD, we have a harder time in menopause and andropause. And that's not something I learned. I believe one of the reasons are that our dropping of our natural reproductive brain protective neuroendocrine hormone, progesterone and pregnenolone. So that naturally starts to drop age 35, and that protective layer, that protective hormone, that protective cushion, part of the feedback mechanisms, starts to diminish, and we get an above threshold hyperreactivity, sensitivity, hormonal swings that make menopause or even andropause for men more traumatic, more difficult, more in my own experience, cognitive changes, right? Like, going from real high clarity and intuition to having that brain fog and lack of clarity. So we can see that. And an idea of who will experience more difficulty in menopause are those of us who've had postpartum depression, severe PMS, because those are signs too that there's been a hormone imbalance. And that if we address the root causes of those imbalances, that we're really going to smooth out this transition. Let me tell you, I've had a decade of working on this.
I've heard some say they go through menopause multiple times.
So true. I mean, seriously. And I joke, I said, this is my third time through menopause. I was diagnosed with early menopause at age 39, premature ovarian failure. I was told I would never be, we were trying to have another child. And I was told I would never have another child except with egg donation. My ovaries resisted the highest dose of injectable fertility medications under the best reproductive endocrinologist. And that was devastating. Oh my God. And just, for anyone listening who struggled with fertility, I mean, God, that is so hard. It's almost a silent grieving that we experience every time that we do see our period, or we, check the pregnancy test and it's negative. And that's just heartbreaking. So I feel for you out there, but I also want to let you know that a few years later, I conceived a beautiful, healthy daughter, Ava Marie, and she's now 8 years old, right? At 42, I had Ava, the child I was told I would never have. So keep hope in your heart, because we get to these underlying issues that are disrupting our hormone, protectively, possibly shutting down our ovarian production, just because if we're in a high stress state, our body's going to protect ourselves first, right? And say, okay, well, maybe now's not the time to reproduce. And so there are layers that we need to go through, from, spiritual healing, soul healing, physical healing, and our mental healing. So those aspects are always part of, my assessment treatment plans, recovery, my online programs too, because we just have to heal those aspects of our hearts as well, to heal our body.
I want to go just draw that out again a little bit deeper. That's so huge. So not only did you reach the point to where you felt better and had fewer symptoms, but you went from being at full ovarian failure. You were non-responsive to ovarian stimulants. And through the steps that you could share with us, and steps you train people on, you went to where not only were you lower in symptoms, you had a baby. You were at the pinnacle of expression of ovarian function. So that's what's possible. The body can regenerate that much. That's so beautiful.
Yeah. And to recover and to have that, really it's a blessing. And I say, God's hand was in it all the way. And part of that were the steps that he showed me. I put this into my restorative health program, but, like 7 steps, right? There's healthy mind to a healthy body, right? We know we need also the important key elements of nutrition and healthy physical movement. That's the second step. The third is healthy digestion, right? We need healthy digestion for glowing complexion. We need healthy digestion for absorption of our nutrients. And we need detoxification, to really make sure that we've cleared up our detox pathways, because that's huge. That is so huge to having a healthy pregnancy, honestly, and healthy hormonal balance. So a healthy detoxification is key. Hormones in balance, using progesterone or thyroid hormones, whatever we need to help with that hormonal balance, natural or otherwise. And then working with inflammation, our sexual health. So those are 7 key components that were part of my journey for restoring my health and reproductive ability. And all that was like really perfect, Alan, and really worked well. Had lost, part of my story, I dropped 80 pounds, and
wow.
There were these physical transformations into a healthy physical state of health. And later, learning the importance of mental, spiritual health, also the key concepts of relational health, the components between elevated cortisol and then low cortisol and oxytocin imbalance, right? Shutting down our body's oxytocin, which makes a disconnect. And as a result of that high stress and not learning that, my relationship struggled. right? And so there's those pieces of the puzzle I put together. And then the last year and a half, it was like, okay, 49, and all of a sudden 10 pounds became 20 pounds, and brain fog, and some like, loss of that clarity that I really rely on, right? Especially I've got an 8-year-old at home, not to mention 2 teenagers who totally thrive on finding your weak points. And when you're a little oriented and, undecided, oh my gosh, they just dig in. So, struggling in those aspects. But really, so seeing this physical change again in this menopausal state with the hormones and thinking, wait, I'm doing everything. Let me go back to doing what I was doing, right? Just jumpstart my detox pathways. And I would drop like 10 of the 20, but then I'd pick it back, and it was really hard. And I was like, what am I missing? And Alan, this is what I've put together that now I'm launching in the Magic Menopause program, because part of this journey has been regaining my mental clarity, especially after having struggled with PTSD for so long. So my mental, recognizing those cognitive aspects were huge. And I definitely didn't want to lose more of it in this stage of my life, right? Like I said, teenagers, okay? Need I say more? And, and so what I recognized is that I had to put myself into what I like to say, an energized, enlightened state, right? I wanted to get into the state of energized enlightenment. And I looked at the programs, I was like, okay, ketogenic diets, they make me crazy. I mean, seriously, I couldn't recommend it to my menopausal patients because I think we didn't have enough carbs to keep our neurotransmitter serotonin, dopamine stable. And I'm like, wait, why is it making me crazy? Yeah. And then, I've always said, okay, well, it's important for alkalinity to be detoxing. So I started checking and actually created urine test strips. I have them here, usually carry them around with me to check my pH and ketone. So I created urine test strips, and they just check pH and ketone, keto alkaline test strips for your urine. And so I said, well, what if I get into alkaline? And then because I started checking, I was so acidic, indoor life, it's, running around, high stress, high cortisol, not getting out in nature as much. Even though I'm eating good foods, my body was still acidic. I wasn't eating enough alkaline foods. And so I started getting alkaline and then getting into ketosis. And oh my gosh, in 4 weeks, seriously, lost 18 pounds. Wow. But that energized, a state of energized enlightenment. And I looked, and I looked into, biblical, and I thought, oh my gosh, Jesus didn't go into the Garden of Gethsemane and starve and fast for 40 days for deprivation. He went to have really clear communication with divine, right? With spirit, with love, with universe. And so that's the state that you get into in a keto alkaline state. But the beautiful thing is we can eat healthy amounts of food. And as long as we're in that keto alkaline state, our body's in this higher, it's just clear. It's like all of a sudden, it's like you take your car in and the oil's all junky, and you're running through sludge and your car engine's not going to run as well. Well, the same with us and our hormones. So what I found too during this time, I had to go to a quarter of my thyroid dose and my hormone dosages. So I needed so much less. Probably don't, necessarily need it, honestly. It's like that. Now it's like a quarter of a dose twice a week, which is blew my mind. But when you look at the physiology, when you look at the cell membrane, the electromagnetic charge over the cell membrane, and what being in a keto alkaline state does, even if it's intermittent, it is, it makes sense. It makes beautiful sense. And you're closing those leaky membranes. You're closing those gaps, and you get more of a normalization of your circadian cycle, because you're also, to be alkaline, it's more than what you eat. It's getting outside in nature. It's getting outside on those long hikes. It's bringing down cortisol. It's sleeping well, having regular bowel movements, all those things that are so important that sometimes don't, the opposite on a ketogenic diet is, you can get constipated, you can have difficulty sometimes, but you become very acidic. And I went back to the research, and I think of you when I do this, because you do this all the time. But some of this research is 100 years old looking at the keto-alkaline connection. And when we're in alkalosis naturally through the diet, we stay in ketosis naturally longer. Do you not think we should be feeding our students this, and our Alzheimer's patients and our nursing homes this type of diet? I mean, seriously, we know the benefits of ketones for brain health, for dementia, for Parkinson's, for neurologic disorders, for epilepsy, seizure. Oh my gosh, but just give it to us in menopause, the world will be a more peaceful place, I'm telling you.
That is beautiful. And I've been aware of your work, and for some time you've had programs, probably, 2006 or so, one of your first ones, I remember, and everyone raved about that. I had so many that participated in it and had wonderful health transformations. So I'm so glad to endorse this and share this with anyone really struggling with menopause and making sense out of that. So yeah, couple insights. So for those who want to just have some changes they can make immediately, what are like top 3 action steps we're going to take today to start improving their experience of menopause?
Would be, I would say, we get into a state like we think we're doing everything right. And, it may have that question, oh, well, such and such was a I think of this, because I hear this from my patient. Well, such and such was a vegetarian for how many years, but she got breast cancer. And, you hear those things, but let's test, not guess, right? Like, I can guess that I'm doing the best diet for my body, but unless I'm testing and I'm really seeing how my body reacts to something, then you could be doing the wrong thing all the time. And with that, we talked about food sensitivities when I interviewed you earlier. When you eat a food sensitivity, your body's more acidic. Mm-hmm. So your urine pH, I mean, it takes pennies. I sell, the urine test strips. They cost pennies. But you can test yourself on a daily basis and trigger, what do you need to do to get alkaline? And I would say, ladies, guys, get alkaline first.
Get alkaline, because that's first step.
Yes, first step is get alkaline, and that's going to be water, getting out in nature. We say don't wear contacts so you can get good sun exposure. I mean, the little tweaks like that, and I go into this whole lifestyle components that are, I totally geek out on it, obviously, because the science now is so clear of what we really, the mistakes we're making. And so we need to just fine tune that. Because I believe, I think as menopausal women, we're tremendously strong and have such a beautiful role in this stage of our life, and that gaining peace and, having our strong presence, like being grounded in the present is just a beautiful that we give, a gift we give ourselves, but also everyone that is learning from us. And so many people are. And so I want the second thing for people to do is really to be expressing is gratitude. And what am I grateful for today? And one thing I ask myself is like, where did I see God today? Or where did I see love today? Where did I see the face of love today? And that's a question I ask myself. I really ask it every night. And I'll say, well, where could I have been more loving? So I like to do that question first thing in the morning before I get out of bed and make the first mistake. But, end of day perspective is enlightening. But, so, looking at that, that's the second step. Okay. And the third is, I would say, really, let's cycle into ketosis. I don't think we can stay there long. First of all, like on a daily long-term ketosis for me. I mean, I've got a child, we have school events, we live in America, and so, and I want to know also, like, when I cheat and I can get back into ketosis in a few days or whatever. So, but getting into that fat burning mode is really beneficial because we're going to have more energy. We have more energy from, a molecule of fat than we do a molecule of glucose. So we want to get into that fat burning mode, number one, to look better, feel better, reduce some cellulite, but number two, to have that energy and clarity. And that's really huge. Now, we don't have to stay there, but the research shows too that including in breast cancer research, a recent study in the New England Journal looked at people who had 13.5 hours of fasting had a significantly reduced risk of breast cancer. And I typically tell my clients 15 hours before dinner and breakfast. So maybe just implement that, because that gives your body to digest a lighter dinner, 15 hours between dinner and breakfast. So just implement that as the third step, and you're already kicking into a huge, healthful, beneficial transformation. And especially when our hormones are fluctuating, we want to be able to use what our body's producing, right? Because there's no substitute for what our body's producing. Now we will pile on some bioidentical hormones, but when your body's using what it's producing, then you have more innate balance, and nothing tops that. And that's the beauty to recognize that, because I didn't think, honestly, that was so possible. And now it's evident in my life and then the clients that I've helped through this.
That is so awesome. So some great tips about menopause, and I'll share information about your program too. It'd be a wonderful thing for everyone. And really appreciate taking the time and sharing your story and just being with us and giving us more perspective that menopause can go well.
Absolutely.
And where should I send people who want to learn more about you and follow your work more thoroughly? What's the best place for them?
Oh, it would be come to drAnnaCabeca.com, so DRANNA Cabeca.com. And also you can do get your menopause report card at magicmenopause.com.
Menopause report card, I love that.
Alan, you can take it too. I want to see.
Can I see what my menopause report is?
Yes, I want to see what you get. I'll have to post it.
I'll let you know.
Okay. How are you doing in menopause, Alan? We'll check. I'm grading you personally.
All right. Take great care, Anna. We'll talk soon.
Thank you so much.